Rehabbing a dislocated foot. Dislocated foot. Ankle maybe? All right, whatever. No doctor assess other than initial ER visit. How do I know to put weight? Bruh. Bruh, come on. Come on, bruh. You're better than that. All right, All right, I gotta say this with a straight face. Please go see a healthcare professional. I don't care who it is. Just please go see someone. What's up, guys? Dr.Nick.DPT here, and today we're going to be doing an Ask Me Anything video response edition. So if you're not following me already on Instagram, every Friday I post an Ask Me Anything, and typically I would respond to those questions on my Instagram stories. Today, however, I want to try and do something a little different. I want to do a little video response to all the questions I get. Now, I haven't taken a look at any of these yet. These are just fresh from my stories. I've got about 50 or 60 questions on here. I'm going to go through and answer the best ones or the ones that I find the most entertaining. So sit back and enjoy. Let's start this thing. First question. I've been having stiff shoulders pain and neck pain. What's the best way to treat the injury? That was quick. Usually it takes 4 or 5 for that one to pop up. But all right, so I get this question almost daily. It's something along the lines of, I have pain here. What's the best thing to do? How do I treat this injury? How do I do X for Y? I literally sat down and wrote an entire ebook that's about 50 pages long about how individualization matters, context matters, why there's no best exercise for a specific issue, because it comes down to the person in front of you. I could sit here and ramble on, but honestly, I would highly recommend just downloading the free ebook. It's completely free if you really want to know what I think the best exercise or thing you should do for your specific injury. Question 2, is plank a good exercise if you have anterior pelvic tilt? All right, so we have to start this one off by defining a few things. What is anterior pelvic tilt? Anterior pelvic tilt is essentially a forward tilting of your pelvis. If you think of the 2 pelvic bones that are attached together at the sacrum, if you have some slight tilting forward, that's called an anterior pelvic tilt. Now here's the thing, a lot of people have an anterior pelvic tilt and have no issues, absolutely no pain. It is not a disease, it's not an injury, it's not a condition, it's just how your pelvis is positioned. I think if it's painful for you to go into an anterior pelvic tilt, then yes, finding ways to train into a posterior pelvic tilt or finding ways to get out of that position can absolutely be beneficial. But from a specific standpoint, I don't treat anterior pelvic tilt. If someone walked into my clinic and said, hey, I have anterior pelvic tilt, what do I do? I'd say nothing. You don't need to change anything. Now, if you have low back pain when you're squatting and you're going into a massive anterior tilt, then okay, maybe that's something that we could try and control. But again, it's more of you're sensitive to that position versus that position being demonized or bad or something that you can't go into without damaging your spine. Next question. If I want to study rehabilitation online, can you suggest a website or advice? All right, I actually, oddly enough, get this question quite often too. What's the best way to study rehabilitation online? So one, if you're talking about physical therapy is a profession. If you want to be a physical therapist, you need to go to graduate school and pass the degree and certifications and things of that nature. If you're just looking to learn about exercise, there's a million different websites you can go to. Social media is obviously an interesting way to get it because it's free. But if you're looking to become a physical therapist and that's your question, I would recommend searching out some PT schools because doing rehabilitation online is not something I would recommend. Question 3, any advice for DPT students who want to work with athletes? I think that's a great question. I think you have a lot of options. I think the best thing to start off with is literally just emailing people in your area, whether that's strength and conditioning coaches, high school coaches, anything like that, where you can just contact them and say, hey, can I do some observation? Worst they can say is no. But even just getting a behind the scenes look of how that functions and how they work with their athletes can really give you some information, or maybe some areas where you could say, hey, perhaps I could step in as a physical therapist during this portion of this athlete's recovery, and then, I could aid them getting back to their sport and then send them back to you feeling better or something like that. I think the other thought process would be to do a clinical, right? So your clinical rotations would be an excellent time to try and find some sort of athletic facility or venue to kind of work at. I don't know how each individual school operates. I know for my school, when I graduated, one of our options was to just simply request a clinical. So you could just say, hey, I want to go do this clinical over in this, on the other side of the country, but maybe it specializes with high level athletes or something like that. I think that's a great way to kind of get an intro to it and really get yourself comfortable with it. Next one, training for high ankle sprain. Not really a question, more of a statement. That's fine. It depends, right? Like, just because you had an ankle sprain, it doesn't mean that you're going to follow the exact same path as someone who had the exact same injury. If I have someone who's 55 years old and they sustain a high ankle sprain and they just want to get back to walking up and down the stairs, that's where I'm going to focus, right? But if I have a high level athlete who's trying to get back on the field in 4 to 6 weeks with a high ankle sprain, there's going to be a vastly different protocol than just for the average person. So context matters here. I can't just give you a general specific, you have to do this, this, and this. It all depends on the person, your goals, and the overall condition at which you're in right now. Next question. Would love to know more lower back pain exercises apart from the one you just posted, winky face. So another thing that I get commonly asked, if you look at my page, I have, last I looked, is like something like 330 posts. Any specific condition, knee, hip, ankle, shoulder, back, there are going to be multiple posts on those specific injuries or body parts or areas. So definitely go check those out. I guarantee you I have more than one post on low back pain. There's probably about 20 to 25 in there. Next question. Popping and click below the lateral aspect of patella on going up the hill could be indicative of what? Could be indicative of nothing. Crepitus, joint noise is non-specific. You could have crepitus and be completely asymptomatic. You could have crepitus and be extremely painful, but it's likely not due to the crepitus itself. It's just a sort of a outlier type symptom. So I wouldn't necessarily worry about having crepitus with walking. I would say that you have to examine the entire clinical picture to determine any kind of relevance as far as crepitus goes. Next question. What is your self-care routine to stay healthy in this industry? Good question. So I don't think that I have some special health routine or training routine that is that unique. I think if you look at historically how I worked out when I first graduated from PT school to where I am now, I think it's vastly different. But right now, my training program is literally just based on progressive overload, trying to get stronger, trying to be a little bit better than I was yesterday. So typically something that I would do is, let's say in a given week, go to the gym 4 times, maybe 5 times. It depends on my schedule, but I like to do like a push-pull legs type training routine. During that period of time, I will work on specific things I need to address. Like, for example, let's say that my knee was bothering me that week, right? I would focus on some specific things to improve my knee, maybe some eccentric squats or progressive overload into maybe a foot elevated position, or modifying my squat to maybe a wide stance, or something along those lines. I really try to incorporate my quote unquote rehab into my actual training, because at some point the rehab becomes the training is the rehab, right? So again, I don't think that if you looked at my training routine on paper, it would look just like any other training routine. What I tend to do is I just try and modify it based on if I'm having symptoms, if I'm having low back pain, if my elbow hurts, whatever. I just try and modify around that. That's really where I think mine might differ from the average person's. And it's really not all exciting. It's squatting, pressing, deadlifting. I mean, that's basically it, with a bunch of variations and a little bit of hypertrophy work kind of peppered in. Next question. Hi doc, hurt my PCL 2 weeks ago. I need some exercises for quick recovery. Again, download the ebook if you want to know why there is no best exercise for any issue. Quick recovery doesn't mean anything to me. Are you trying to get back to sprinting? Are you trying to get back to jumping? Do you want to just walk up and down the stairs without pain? What degree of hurt is your PCL? right? Did you fully rupture it? Do we have a grade 1 sprain? All these things matter, right? I can't just give you that based on a sentence. What exercises do you recommend for spondylolisthesis? Another another general question. So spondylolisthesis is an anterior slippage of the lower vertebrae. There are different grades, right, ranging from basically mild to extremely severe. So it depends on the type. If you have something extremely severe, then maybe I would avoid excessive kind of loaded lumbar extension in that anterior pelvic tilt position. But it's really going to vary person to person. And if you have a low-grade spondylolisthesis that's asymptomatic, I wouldn't do anything special for it. I would continue to train. I would continue to try and get stronger, perhaps adding in some specific things to address what might be going on with you. But I don't think that, by and large, just that diagnosis needs any special handling or special training program. Next question, how can we check for ligaments tear? MRI, CT scan, yeah, easy. All right, I had a discectomy on 2 discs 8 weeks ago, and the sciatic pain is coming back. What you reckon? So again, man, I can't, there could be a million things. It could just be sensitivity. You could have just had continued sensitivity down that leg from the degree of nerve irritation that was going on prior to surgery. It could be completely normal. It could be abnormal. I would recommend consulting your surgeon. I would consult your physical therapist who you're hopefully working with. And those would be the 2 people that you need to chat with for your specific condition, especially post-operative, right? Post-operative care, that really needs to be handled by the surgeon, the physician, whatever, because that's very specific to your individual injury or your individual situation. Tendonitis. Tell me something about this. Tendonitis means inflammation of a tendon. Boom. That's something. Pain in the sacral area. What do? Come on. Are you guys trolling me here? Is this you trolling me? It's killing me. Finally, a real question. All right. Real question. Samsung versus iPhone. Thank you. What a great question. The obvious answer here is Samsung. Come on. I will fight anyone who says differently. How's that? I just got the new S10. This is not sponsored. I wish they sponsored this. That'd be sick. It's pretty phenomenal. The picture quality is insane. It's got this wide angle view that I love. It is so much better. The picture quality is ridiculous. Highly recommended if you were wondering. We can now move on from that advertisement. Do you have any posts/suggestions for strengthening hip abductors? Yes, I do, my friend. I've got, I would say, no less than 20 posts on hip abductors. You can look anywhere in my posts that have to do with the hip, lateral movements, low back pain. There's some lateral hip strengthening components in there, so that's definitely, it's all over my page. Does Chiro Treat help for back pain? If yes, would this fix the issue for long term? All right. So I do want to answer this question just because I think there's a lot of misinformation out there in terms of what physical therapy treats, what chiropractic treats, and those sort of things. So first off, I want to say this. There are good physical therapists and there are bad physical therapists. There are good chiropractors and there are bad chiropractors. I don't categorize either profession just solely based on their profession. I don't think that profession title necessarily matters. I think you can be good or bad at your job regardless. And that goes for any industry, not just the medical industry. That said, chiropractors definitely, people tend to think of chiropractors when they have back pain, right? That seems to be the common thread that I hear. It's like, people are like, oh, I hurt my back, I need to go to a chiropractor. But people don't understand that physical therapists also treat the same thing. So as a physical therapist, one of the primary caseloads in terms of anatomy that I have is low back pain. Low back pain is one of the most common things that I see in my clinic, followed by athletes. So athletes trying to work back to getting into certain things. But that said, low back pain is the primary thing that I treat in my clinic. When you say chiropractic, will that fix the issue? I tend to stay away from the word fix, right? Because when you say fix the issue, you're implying that you're broken, that there's some sort of pathology or things like that that is inherently being fixed by an exercise or some sort of technique, whether that's cracking a joint, doing some sort of soft tissue, using tools, whatever. To me, that's a poor mindset to have, because when you come to me, I'm not fixing you. I'm not trying to solve your pathology or anything along those lines. In fact, most people get better and have less pain despite the pathology being there and persisting and not really changing. This is quite commonly true in tendonitis or tendinopathy being the better term, or even if you look at things like degenerative disc disease or herniated discs or arthritis or things of that nature. So no, I would say that fixing is the wrong mentality to have. Don't go into seeing someone and thinking you're going to be fixed. I don't think that that's the way to look at that. Next question. What's your take on clicking sound and shoulder joint and fixing it? Yeah, again, clicking, I'm not concerned with clicking in and of itself. If it's clicking combined with maybe a severe catch or a high level of pain or instability or feeling of dislocation, something along those lines, you have to give me more than just clicking. If it's just clicking in and of itself, I'm not worried about it. I would continue training. I would continue trying to get stronger and progressing your exercise. I don't really see, again, a special program that you need to perform for clicking. What is your advice for students struggling with imposter syndrome in PT school? That's a great question. I love that one. So if you don't know, imposter syndrome is essentially people feeling inadequate. So like, let's say, for example, you come to see me. You come into my clinic and I don't feel confident that I'm a doctor of physical therapy. I don't feel good about what's going on. So I almost feel like I'm an imposter. I'm really not. I'm not real. I'm not a part of the profession, blah, blah, blah. So it's essentially boils down to feelings of inadequacy. So for imposter syndrome, I think all of us deal with it, or at least I can speak for myself personally. For years, I felt that way. I didn't feel like I was good enough. I didn't feel like I was worthy, if you will, of helping these people or being in this position. And I think what you have to understand is you've gone to school for a long time, right? If you're in PT school or if you are a PT, you've gone to school for a long time. And that doesn't necessarily mean that you're smarter than anyone or anything along those lines, but you worked your ass off to get where you are. And I think we can help a lot of people, right? Maybe some people will come in and don't feel like we didn't help them because we didn't fix them, and they have that mentality that they're broken and they are coming to us to get fixed. But I think if you really boil it down, we have a lot of tools at our disposal to really help these people and to try and get them to understand their pain, to kind of de-threaten what's going on, to empathize with them, to listen to them, and to really be that first line of defense, that healthcare provider that actually sits down and takes time with them, right? I mean, you look at the medical field, it's so often people go to the doctor's office or whatever, and they're in and out in 3 minutes. And I'm not knocking doctors. I think that you can still be a phenomenal doctor and be quick on those things. But at the same time, I think physical therapy is in a very unique position where we have the ability to spend a lot of one-on-one time with our clients and our patients. And I think that we can really provide a service and some value to them if we just know how to kind of go about things. And I think that starts with active listening, really developing empathy for the patient, and really trying to get them to understand what's going on without scaring them and without throwing nocebo at them and getting them freaking out that they're broken and there's all kinds of things wrong. So I think if you understand those things and you understand that you really can provide value to the patient, I think over time that imposter syndrome type feeling is going to kind of gradually dissipate. But again, I think it's normal. I went through it. I think a lot of people that I know went through it. So that's just my opinion. Next question. Hi, how are you? I am 33. I have a serious knee problem. That's unfortunate to hear, my friend. If you would like a consultation with me, feel free to send me a DM or fill out the little link that I have at the bottom here. That's perfectly fine, but I don't know how much I can help you with just that little sentence. Next question. Rehabbing a dislocated foot. Ankle maybe? All right, whatever. No doctor assess other than initial ER visit. How do I know to put weight? Bruh, come on, bruh. You're better than that. All right, all right, I gotta say this with a straight face. please go see a healthcare professional. I don't care who it is. Just please go see someone. Please, honestly, just go see someone. I'm not laughing. Come on, dude. Go see someone. All right. What is the biggest thing you've learned as a clinician outside of PT school? Ooh, that's a good question. I think the biggest thing that I've learned as a clinician outside of PT school was the business side of things. And when I say that, I mean running my own business, being the front line of contact for my own business. And I don't think that we get that much of that in PT school. You get exposed to it a little bit. And I think that if you're really interested, you read about it and you try and learn about it. But at the same time, for me, I really felt like that was an area that I lacked. I'm still working on it. I'm always going to be working on it. But I'd say that the business side of things, the entrepreneurial side of things, that's probably the biggest thing that I've tried to learn outside of, if you talk about clinical type stuff. That's been the biggest key to my, if I want to call it success, just to where I am right now, is just learning how business functions, learning how to market, learning how to talk to people, and learning how to really value what you do as a clinician and how to convey that. That's probably, if you know that, I think you can be successful 80% of the time. I mean, that's really the bread and butter, at least I think, of what a successful business is knowing what your value is and conveying that to the customer and to the individual. Is a DPT a higher credential than Masters in Science PT? I don't like the term higher credential. I get what you're trying to say, but let me give you an example. If you have two clinicians, one has a Masters in Science and PT, and one has a DPT, is one a higher clinician? No, absolutely not. I would say that one went to school for longer than the other, but I don't think that. I mean, you could, I guess, equivocally say that a master's is harder than a doctorate. But when you're a PT, you're a PT, right? So if you graduate with a bachelor's in PT, a master's or doctorate, you're still a PT. I think it may be different in other countries. Don't quote me on this. I just know of the U.S. I have a master's in PT and a doctorate in PT, so I guess I can speak to this a little bit. There is no difference in what I could do as far as autonomy, as far as having more scope of practice by getting my DPT. It was just something I wanted to do for myself. So I don't know that you can say it's a higher certification. I would say that, it's more schooling, which I think is a fair statement, but, I don't think it necessarily means you're a better clinician or anything along those lines. It can go both ways. How your experience with tinnitus patients? I don't work with tinnitus patients. That's not something I have experience in. So that's how my experience is. Please tell some exercises to cure bow legs, ? All right. So bow legs, it is not a disease. It is not, you're not a mutant. It's not like you have to have some sort of vaccine against it. It's a structural change in your legs in which they go out. They bow out, right? That's what they call bow legs. Number one, I would say outside of surgical intervention, you are not going to change your bow-leggedness. Now, I think that perhaps there's potential to slow progression. Maybe working on some exercises, maybe strengthening the lower extremities, maybe trying to work on control. Maybe that could help slow the progression, although I don't really have any specific foundation to base that on. It's just a thought process or maybe a consideration. I would say you should be training anyway, right? You should go through your training program. You should get stronger. You should exercise regardless of the situation. I would say that maybe you just have to work on, your position with squats. Maybe you just have to change things based on how your anatomy functions, how your hips move, how your knees move, that sort of thing. And maybe you just have to be a little bit more diligent on specific work. And maybe not. Maybe you'll be absolutely fine and have no issues. I don't think that across the board you can say that every single person with bow legs needs to do this or is going to have this issue, right? I think that's a vast overstatement and it just makes things too binary. I have scoliosis. Do you think I can fix it or will be the same? So this goes in the exact same category as the previous question. Scoliosis is a curvature of the spine. There's varying degrees of it. Some require surgical intervention if they become aggressive or extreme. So I guess that would be the way to fix it, quote unquote. Again, I don't think well, I know that you're not going to be able to change the curvature by just exercising, by moving. Again, perhaps you can slow some degree of progression. Perhaps you can maybe mitigate symptoms. But at the end of the day, it's a structural change in your body, and it is what it is. I would say you don't need to freak out about it necessarily unless it's extremely painful or it's progressing, and in which case, see your doctor. Next question. How's the experience with the Samsung? I'm assuming the S10. So I already gave my review of it. I don't want to keep talking about this because this is not a ad for Samsung, but I love this thing. The camera quality is insane. The wide angle lens is insane. I'm going to try and film a couple videos for my Instagram on it and see what the quality looks like, but it's been spectacular. Final question is in what appears to be Russian. So I wish I spoke Russian. I am an uncultured swine and just know English and some broken Spanish. So unfortunately, I will not be able to answer that question. But thank you guys so much for submitting questions. I do this every single Friday. I submit an Ask Me Anything. So if you want to have your question answered or featured, follow me on Instagram at Dr.Nick.DPT. Again, I post exercise videos, rehab videos, all of that on a daily basis, and the Ask Me Anythings are weekly basis. If you guys want these videos more frequently, just let me know, and I can try and make these on a more consistent basis. Otherwise, thanks for watching. See you next time.